Welcome, everybody. I hope that the beeping from people entering isn't too disruptive, but I won't have my mic on the whole time, so hopefully you guys won't hear it. Welcome. I feel very sad, but also feel very empowered by having this meeting together during such a devastating time. For those of you who don't know me, I'm Shendel Ifra Goldfez. I'm currently the Chief of Operations and Finance at JOMA and a fourth-year medical student. I currently live in Passaic, New Jersey. And I'm going to introduce the session, also introduce our speakers. So I actually read a quote another day that I shared with everybody. And Miriam, if you don't mind admitting people as they come in, because it's going to be hard to talk when I'm admitting people.
Yeah, I'll do that.
Thanks so much. All right. So I shared a quote on the Joma chat the other day, and the support group and the Israel group have been such an amazing experience to be able to share with all of you and all of the feelings that I know are all so common and we're all having at the same time. But the quote from Adam Grant about empathic distress, that the feelings that we're having, knowing that we are so hurt just from knowing what's going on in Israel and feeling like there's nothing that we're able to do to help. Even when we can help, it's times like these that nothing feels like it's enough. So, with that being said, Joma is trying to help, and all of the involvement that we've had from so many of you um, trying to help as well. We're also trying to create opportunities where our community can give back through a few initiatives in Israel. So, as most of you know, but in case anybody who doesn't, we have a few initiatives going on right now. One of them includes our Boots on the Ground fundraising campaign, which just reached our goal. And those funds are being utilized directly to provide essential supplies to 3 divisions of the Israeli army. Our JOMA member, Shuli Kulak, Dr. Shuli Kulak, is on the ground in Renana, Israel, and she's responding to firsthand requests and verified supplies to the units that are in. So we also have collaborated directly with the Ministry of Health, and we're dispatching specialty doctors who are needed as a top priority in Israel. We have a large group of physicians who are already mobilized, ready to go. We're waiting for things like getting them licenses in Israel. There are a lot of people working to expedite the process to try to get them in by next week. And we're also looking forward to growing the group as we get additional reports from the Ministry of Health of what's needed. With all that being said, tonight is a night where we can all glean some encouragement despite such a devastating past week, and also feel more united. I've been hearing from Israel, when I talk to my friends in America, most of us are really, really down right now, understandably so. The morale in Israel is really high because everyone is united and everyone's together. And there is such an important component of going through all of this as a family. So I'm very happy that we can all come together tonight. And I'm going to start by introducing Miriam Borvik. So Miriam Borvik is a director of community health at JOMA. She's also a first-year medical student, and she was a former first lieutenant in the IDF Education Corps and a mother of 2. So with that, Miriam's going to start us off tonight. Handing the floor to you.
Hi, everyone. I likewise have been feeling all of the challenging feelings and the waves of emotions that you all have. So I am really grateful that we could all get together tonight. I am going to start off by reading a paragraph of tehillim. I put it in the chat if you want to follow along. And then I want to share with you a song that an Israeli artist just put out earlier today. So if you want to open up the tehillim in the chat, go ahead. Just stay muted, and I will read that out as we think of our loved ones and our family and our hostages. שיר המעלות ממעקירים קראתיך אדוני, אדוני שמע בקולי תהיינה אזניך קשובות לכל תחנוני. אם עוונות תשמריה, אדוני מי יעמוד. כי עמך הסליחה למען תברא. קיוויתי אדוני כפתה נפשי ולדברו החולתי. נפשי לאדוני משלמים לבוקר משלמים לבוקר. יחל ישראל אל אדוני, כי אם אדוני החסד והרבה עמו פדות, והוא יפתה את ישראל מכל עוונותיו. I'm going to share my screen now, and I want to share with you a song from Hanan Ben Ari. He put it out 15 hours ago, so it's very new and very relevant. Let me make sure that I'm sharing my audio. Okay. Before I share the song, I know that we all have different backgrounds in Hebrew, so I want to just tell you a little bit about the words of the song. He put a dedication under the song that says, "This song is dedicated to my country, not the one that was here just 1 week ago, but the one that we will establish anew when all of this is over, when we rise up from this horror and we return from battle." The chorus talks about singing an old song because we've all walked this road before. And it talks about how we remain faithful and that we will not be broken, whether in peace or in turmoil. We stand strong, and Israel is our homeland. And so I'm going to play that for you now.
מקווה שאת עוד שומרת רגעים שמחים למזכרת. פעם אנשים עוד כתבו לך כאן שירים על מחברת. זוכרת היפהפייה נרדמת, עד מתי תהי מדממת? ברחובות כולם אין חלון ואין סולם, אין גם דלת או שלט. אז שר לך שיר ישן, שיר ישן, שיר ישן, נשאר לך נאמן, נאמן לעולם, לעולם. הנביאים חזו לך אחרת, מישהו נרדם במשמרת. איפה החלום? אין אמת ואין שלום, אין גם צדק, רק צדק. אז שר לך שיר ישן, שיר ישן, שיר ישן, נשאר לך נאמן, נאמן לעולם, לעולם. לעולם לא נשבר, בשלום ובצר, במתוק ובמר, רק איתך אני שר.
No war is Senator Biden. We have no place else to go.
רק איתך אני שר. את היחידה מיוחדת, לעולם תהי לי מולדת. גם על סף תהום, גם בתוך הגיהנום, את גן עדן, גן עדן.
תשכח ימיני, תדבק לשוני לחכי, אם לא אזכרכי, אם לא אעלה את ירושלים, על ראש שמחתי.
Thank you so much, Miriam, for sharing that. Thank you so much, everyone, for being here. I do want to encourage anyone who, this is a semi-private forum. I love to see everybody's faces. I think it feels more together the more people we can see. So even if you're in your kitchen and you're not necessarily sitting down, feel free to turn your cameras on. I encourage you to. Okay, I'm going to introduce our speaker for the night, Dr. Tal Weinberger. As most people here know, Dr. Tal Weinberger is currently the vice president of Anjoma's board of directors. She recently assumed the role of director of psychiatry at Hamed Health Center in Lakewood, and she is a consultant for perinatal psychiatry consultation line for Postpartum Support International, consulting with providers on clinical questions in perinatal psychopharmacology. She lectures and has several publications in the field of women's mental health, and she previously was the founding director of Jefferson's Psychopharmacology Specialty Services, which specializes in outpatient clinic providing supervision, teaching, and clinical care. Dr. Tal Weinberger is a phenomenal human being who I have the pleasure of knowing. And I am very confident that she's going to give us a lot of words of chizzuk, encouragement, and ways that we can support each other during this really, really hard time. So with that, I will hand the floor over to Dr. Weinberger.
Thank you so much, Shandel, for the really amazing introduction. I'm so honored, and I'm so honored to be asked to speak tonight to this really group of like really, really amazing women who I can say personally have really provided so much support to me over the past week. You know, I can't speak for other people, but, you know, I felt tremendously supported by this group in the past week. So I was asked to talk about coping strategies and predictors of resilience. And following this JOMA support chat for the past week, 8 days, million years, I really feel like a lot of what I've seen has been like a model for really the most adaptive coping strategies that experts really recommend in the setting of trauma. And, you know, it's small comfort, but you know, we're feeling very, very hurt and vulnerable. But if we zoom out, it at least appears that we're modeling resilience, at least to each other. So I just want to start by acknowledging and just naming like some of the like unsolvable, intractable questions and problems that we're all struggling with that I've just seen featured so prominently in conversations over the past week that have already, some of them have already been named by Shandel and Miriam. You know, how do we help in a meaningful way? How can we even think about what enough is? What does it mean? How do I cope with the fact that I'm here and not in Israel? How much do we try to engage people we had seen as colleagues or friends around issues where we really feel like they're misinformed at best and really frankly biased at worst, especially when their opinions are expressed in, you know, a clearly insensitive manner? That's a really big one. Should we give up on trying to educate people since they're not going to be convinced anyway, and protect ourselves from further pain and insensitivity? How important is it that my institution that I identify with and, you know, have devoted a lot of my professional life to, how important is it that they put out a strong statement? How important is it that I assert myself to make a strong statement? Or is nobody really listening anyway? And I think the most important question that like I think is sort of underlying everything that we're asking and talking about is how could it be that no one's listening? Like that's really what we're struggling with. Like how could it be that no one's listening? You know, we're asking these questions, we're trying to talk about what we're struggling with, and we feel like nobody's listening. How could that be? And I think, you know, it's amplified because some of, like as doctors, some of our really most challenging, meaningful, emotional moments are really shared with our supervisors, our colleagues, and our trainees. You know, we feel, and it's true, that we share a common commitment and passion to the care of our patients and, you know, to the concept of compassionate care in general. And we form really strong connections with these people around these experiences. And so it's like especially confusing and hurtful when suddenly we feel like our values and those of our colleagues are so misaligned. So again, I'm naming it. There's no answers to these questions. But I feel like people have really done a tremendous job of like supporting others who are struggling with these questions that have no answers. So, you know, I think against the much larger backdrop of just a horrific, unspeakable situation that is essentially just terrifying and out of our control, in the literature on like resilience, the degree of control that a person has over the stressor that they're experiencing is really a crucial determinant of their resilience and of the outcome. So, you know, this is particularly true in early life, but throughout, uncontrollable stress is thought to lead to what we call learned helplessness, which basically means that the person experiencing the stress is conditioned to believe that they're essentially unable to change their circumstances of the situation, and so they just stop trying. And you know, what we see in the literature from that is that then that person's ability to then implement effective, active coping strategies can be reduced in the future, like with a subsequent stressor, that they've sort of learned and generalized this lesson that that their that they're incapable of actively changing a traumatic or stressful situation. But when somebody can master even like a small part, even some specific aspects of a stressor, then we see that they're more likely to be resilient in the face of subsequent uncontrollable stressors. So in other words, when you're able to retain some agency in situations that otherwise feel overwhelming and uncontrollable, number one, you do become more resilient in general. And number two, you're able to generalize that experience and employ more active, constructive coping strategies in future difficult situations. So I'm going to quote Dr. David Polkowitz a lot. He's the chair of psychology and Jewish education at the Israeli Graduate School of Jewish Education and Administration at Yeshiva University. He is often at the center of community education and support around tragedy and traumatic events in the community. And he's just been speaking nonstop to multiple different audiences in the past week. And his general message is that the only thing that we can control in a situation like this is what he calls meaning making, right? That like we can't control any of the circumstances, but we can control what meaning we make of it and what we take from it. So in other words, this can transform, unspeakable, horrific situations into an opportunity to connect with people, to promote achdus, to do chesed, and make this a growth opportunity, I think, as was like very powerfully, very, very powerfully exemplified by the song that Miriam played. There's no one way to do this, but really the essential ingredient is to make this like an active opportunity for constructive response. Everybody kind of can choose their own way of doing that, but sort of that's the essential part, is that it's an active opportunity for constructive response. And I think really people are doing this amazingly and actively in JOMA. There's just, as Shandel mentioned, we've got multiple fundraising campaigns. There's been just such an overwhelming response to these campaigns. We have, moms of lone soldiers reaching out to physicians in Israel to help bring supplies to her son on the front lines. It's really remarkable to see kind of everybody's active meaning making. We use the term coping strategies a lot, and it's sort of a catch-all phrase, which can mean a lot of different things. I'm not here to teach like specific coping strategies like mindfulness or deep breathing. There's people who can do that a lot better than me. I'm not minimizing those at all. They're incredibly helpful strategies. I think we actually have an event coming up in the future where that's going to be more prominent. But just speaking in general about coping, in general, the literature on resilience distinguishes between what we call active coping, which means like employing strategies to change the qualities of the situation, or to change the way we perceive the situation, as opposed to avoidant coping, which is our behaviors or mental processes that are employed instead of dealing directly with the stressor to kind of distract ourselves from the stressor. Now, obviously, there's a role for distraction, especially in the immediate aftermath of, an extremely painful, traumatic event. But thinking sort of long term and as a primary coping strategy, people who do primarily exercise avoidant coping are at higher risk for psychological distress and other negative responses. And we see active coping consistently associated with adaptability and psychological resistance. So we see this, I think in Torah literature and in general, Jewish literature as well. So I also pulled this from a Dr. Polkowitz article, but the Rav Yosef Soloveitchik, in one of his seminal works called Dodi Dofek, writes, we ask neither about the cause of evil nor its purpose, but rather how it might be mended and elevated. How shall a person act in a time of trouble? What ought a man or woman to do so that he does not perish in his afflictions? The halachic answer to this question is very simple. Afflictions come to elevate a person, to purify and sanctify his spirit, to cleanse and purge it of the dross of superficiality and vulgarity, to refine his soul and broaden his horizons. The halacha teaches us that the sufferer commits a grave sin if he allows his troubles to go to waste and remain without meaning or purpose. I also want to quote from Dr. Eva Eger in her remarkable book, The Choice. If any of you have not read The Choice, please put it at the top of your reading list. It's a remarkable book. Dr. Eger is a clinical psychologist and a Holocaust survivor. And in The Choice, she really beautifully explores her own pathway to resilience and her pathway to helping her patients to resilience. And so just like there's a lot of amazing quotes, but I had to choose just one. So she writes, survivors don't have time to ask, why me? For survivors, the only relevant question is, what now? So just an important, I think, clarification point is that this is an internal process. This is not something we should be telling anybody else to do or making meaning for anybody else. We can't tell others what meaning they should find in a trauma or like conceptualize kind of what it means on a larger scale for the community. That's not our role, but it's purely an internal process of us finding meaning for ourselves. I just also want to add that davening, in addition to, all of its other pivotal benefits for us, is also, an active process. It's something active that can be done in the face of events that are otherwise out of our control. So in a similar vein, resilience is also strongly associated with a person's ability to like step back and kind of like objectively evaluate their negative thoughts and replace them with more hopeful and hopefully more realistic ones. This is we call this cognitive reframing. And it's a process of like deliberately, mindfully, consciously reassessing adverse or traumatic events. So Viktor Frankl, Dr. Eger was a student of Viktor Frankl in Man's Search for Meaning, attributed his survival and his psychological endurance in the concentration camps to the belief that striving to find meaning in one's life is the most important, powerful, motivating, and driving force to continue living. The Torah contents I again pulled from a Dr. Pelkovitz article, but Rabbi Shimon Schwab talks in his Perush on Chumash, talks about the word nechama. So right, nechama meaning it's a comfort, and used in the phrase like nichum avelim, comforting mourners. In the Torah, besides for being used in the sense of comfort, which is its primary use, that's how it's primarily used. It's also used to describe a process of changing of mind and shifting of perspective. So an example is actually from this past week's Parsha, Bereshis, V'yinachem Hashem ki asa es ha'adam ba'aretz. So at the end of the Parsha, when people are starting to become more morally depraved in a way that leads to the Dor HaMabul and the ultimate destruction of everybody other than Noach, we see Hashem say V'yinachem, right? Using the word Nechama or Nichum, that V'yinachem Hashem ki asa tzadam ba'aretz, and here the word is translated as a changing of mind and perspective. He had just shortly prior created humankind, and now he's shifting his perspective. Was this something actually that that should have been done? Similarly in Shmos, after the Chet HaEgal, Hashem initially plans to wipe out the Jewish people and just build a nation from Moshe, and Moshe davens and convinces him otherwise, and Hashem forgives the people, and the language that's used there is V'yinachem Hashem al hara'a asher diber la'asos la'amo. Hashem nachem, right? He changed his mind. He had a different perspective. He decided to save the people instead of destroying them. So sort of what this captures is that that part of the comfort process, part of nechama is a shifting of perspective, right? And that the shifting of perspective and good can emerge really from the most tragic events and can present us with opportunities to become more focused on what matters and shift our perspective in a way that focuses on positive change that comes from coping with adversity. We see similarly in the medical literature, and there's sort of more and more evidence of this, that the course of like multiple medical illnesses are modified and improved and determined by treatment of depression, right? And also by teaching stress management skills, including problem-solving skills and how to change the attitude towards sources of stress. So in other words, people whose depression is treated, who learn these skills, are actually, in many cases, they will actually have an improved prognosis in their medical illness. Okay, so another really important factor in resilience and coping is the presence of social support. And studies on individuals who like fall versus thrive in the face of adversity, like a really important ingredient of resilience is having at least one person who cares. Like that's like crucial. And we see that actually both the presence of social support, like the actual presence of social support in someone's life, and also the behavior of seeking out social support is associated with resilience and flourishing in the face of major adverse life events. And we also have evidence for the inverse, that people with poor social support are more likely to develop psychiatric disorders, including PTSD. And so social support is an incredibly important factor in promoting resilience. And I really, again, personally feel like JOMA's been especially strong in this area. There's just been such an overwhelming outpouring of support, I think mostly right in kind of some of the contexts I talked about above, where people are really struggling with feeling very hurt and disillusioned by like opinions expressed by colleagues that they find to be incredibly hurtful and problematic. But even, well beyond that, to family members who are currently in harm's way, to fit people who have lost family members, the outpouring of support has been really tremendous. So I want to just finish by talking really briefly about when to seek professional help. And research has really outlined many ways in which trauma and stress can negatively impact a person. We know that, right? Like that's, trauma is kind of a buzzword. We know that it can have a very significant negative impact on a person. But it's really important to keep in mind that resilience is actually the most common response to trauma. Even in severe trauma, like really severe trauma, most people recover. Resilience is the most common response to trauma. Just to emphasize, right, I think people often like kind of use the term trauma and post-traumatic stress disorder, sometimes even interchangeably. Post-traumatic stress disorder has the word disorder in it because it is not the norm. It is a disorder. It is not the normal response to trauma. The norm is recovery. And sort of in support of that, in sort of population surveys, between 50 to 60% of the general population have experienced some sort of a significant trauma in their lifetime, but the prevalence of PTSD is estimated at about like 7 to 8%. So again, it's very real, but most people do recover. Symptoms experienced by most people following trauma are brief and transient. In the month or two after 9/11, 7.5% of Manhattan residents, overall Manhattan residents, reported symptoms meeting criteria for PTSD, but then 6 months later, only 0.6% met criteria. So the take home here is that there are high levels of symptoms initially, just about not everything, but many things are normal, but that most recover naturally with no intervention. The most important intervention in the aftermath of trauma is really social support and time. Sometimes it's important to help people reframe narratives around safety, but again, most important is social support and time. Trauma therapy, kind of what we call trauma therapy, is really has been shown actually to at times be harmful in the immediate aftermath of a trauma. It absolutely has a role later on if somebody actually develops, more persistent symptoms that are thought to be more pathological. But what somebody needs in the intermediate aftermath of a trauma is not a psychological intervention. They need social support and they need time. After a period of time, and I think, there are kind of set periods of time defined in the DSM, but, the time, I think we all sort of subjectively think about time to recovery as, kind of more fluid and really dependent on the person and the stressor. But more pathological responses would include continuous distress with really no periods of relief or relative calm. The person, after a prolonged period of time continues to be in distress most of the time or all the time. That would be something that would be concerning. Severe dissociative symptoms, so people, who feel who have dissociative symptoms, who feel like they're kind of outside of themselves, and that, continue even when they're safe. And really intense, intrusive recollections that are fearfully avoided by the person, or experienced really as intolerably painful, that persist or seriously interfere with a person's sleep. Extreme social withdrawal is another, again, sign that, perhaps more professional help is needed. And, obviously, as we were talking about, even in the intermediate aftermath of a trauma, we should try to provide, social support. It's an important part of recovery. And then, the other thing is sort of the consistent inability to think about the trauma, the avoidance of thinking about the trauma and only just kind of emotionally experiencing it and having it overwhelm the person. So those are symptoms that, might make somebody think that, that more a higher level of professional help should be sought out. But again, just to sum up, this is an evening of chizzuk and solidarity, and I really just think everybody needs to keep doing the amazing things that they've been doing. I have no doubt that people will continue to find new ways to be amazing and support each other, because that's what we do.
Thank you so much, Dr. Weinberger. I think that resonated with everyone, and I totally agree. The support chat and just seeing how everyone's been connecting and building each other up. This is why no one can ever get rid of us, because Israel is always in it together. It's just beautiful to see, and thank you for sharing ways that we could continue to help each other. I wanted to, before we move on, I want to open the floor to everyone to, speak and give comments and thoughts or ask questions. But I wanted to introduce Miriam Borvik's husband, who I believe was also former IDF officer. Miriam, is that correct? Yes. Also has 2 kids and a wife in medical school. So he is going to say Mishaberach for the soldiers, and then we will continue with our discussion.
Shalom, everyone. I happen to have a lot of family, and as does Miriam, and friends who are serving right now on the front lines. But I heard a beautiful answer when someone was asked, someone was told that they look distraught in this situation. Do you have family in Israel? And she answers, yes, I have millions of brothers and sisters. And I think that's how we're all feeling right now. So with that, I'm going to say this tefillah for all of our brothers and sisters who are on the front lines in Israel. Mishaberach Avoteinu Avraham Yitzchak veYaakov uYevarech et chayalei tzva Israel העומדים על משמר ארצנו וארץ אלוהינו בגבנון ביד מדבר מצרים ומן הים הגדול עד לבוא הערבה ביבשה, באוויר, ובים, הוא יברך את חיילי צבא ההגנה לישראל. תן אדוני את אויבינו הקמים עלינו נגמר. הקדוש ברוך הוא ישמור ויציל את חיילינו מכל צרה, מצוקה, מכל נגע ומחלה. ישלח ברכה והצלחה בכל מעשה ידיהם. ידבר שונאינו תחתיהם, ויעטרם בכתר ישועה ובעטרת ניצחון, ויקוים בהם הכתוב, כי אדוני אלוהיכם ההולך עמכם להילחם לכם עם אויביכם, להושיע אתכם, ונאמר אמן.
Amen. Thank you so much. Okay, I want to open the floor up for questions, comments. Anyone have things to share? Love to hear from everyone. I was just wondering if there was a way to join the support chat, or was just for physicians or not students. The support chat is for all physicians and trainees. So medical school and up. For pre-med students, we have another chat just for our pre-med students, and they're also welcome to join the community-specific chat. So we have the East Coast, West Coast, Canada, Israel. So for any pre-meds or med students out there, you should know that you have access to that. If you are not on a support chat and you want to be on one, please email admin@joma.org, and we would be happy to add you to the chat.